All right, welcome to The Explainer. Today we're diving into a hidden struggle that affects one of our most basic, fundamental functions, swallowing. I mean, think about it. It's something most of us do hundreds of times a day without even a flicker of a thought. But what if it wasn't so simple? For millions of people, eating a meal isn't just a simple pleasure. It's actually a source of anxiety, of difficulty, and sometimes even danger. This struggle has a name, and we're going to break it all down. So, clinically speaking, what is it? Dysphagia is an impairment that causes a delay in getting food or liquid from your mouth down to your stomach. And this isn't just about someone being a slow eater. This is a real physiological problem. It can be temporary, it can be chronic, and it can range from just, mildly uncomfortable to being severely debilitating. So what does this actually feel like? Well, the signs can be all over the place. Some subtle, some really alarming. It might be that constant feeling like you have to clear your throat, or maybe you notice it just takes you way longer to finish a meal than anyone else. For others, it's that terrifying sensation of choking or having food go down the wrong pipe, which is a process we call aspiration. Okay, so to really get a handle on dysphagia, we first need to understand where the problem is. It's generally broken down into two main categories, and it all depends on which part of the swallowing process is misfiring. So on one side, you have oropharyngeal dysphagia. This happens right at the very beginning, up in the throat. It's a problem with just starting the swallow. On the other side, you've got esophageal dysphagia. This happens after you've already swallowed, when the food is on its way down the food pipe. People usually feel this sensation more in their chest. Okay, so we know where the problem can happen, but the next question is, why is it happening? Well, the why of dysphagia usually falls into one of two buckets. Either something is physically blocking the way, or the muscles just aren't moving right to push things along. Think of a mechanical obstruction like a literal roadblock. Something is physically in the way. People with this problem often find it harder to swallow solid foods, but liquids go down just fine. A motility disorder, though, that's more like faulty traffic signals. The muscles aren't working together in the right sequence, and that typically causes trouble with both solids and liquids. And the actual underlying causes are incredibly varied. Obstructions can be caused by things like strictures, which are just narrowings, or something called a Schatzky ring. Motility issues can pop up from conditions like achalasia, where the muscles don't relax like they should. And, very often dysphagia is connected to neuromuscular conditions, like a stroke or Parkinson's, which can mess with the critical brain signals that control our swallowing muscles. So, with all these different potential causes, you're probably wondering, how on earth do clinicians figure out what's really going on? Well, the diagnostic journey is a really structured process designed to do exactly that. It all starts with a simple, detailed conversation about your symptoms. Then, that's followed by a physical exam. And then comes the really crucial part, specialized tests that let doctors actually see the swallow in action. And all of that leads to a treatment plan that's tailored just for you. And these instrumental tests are really the key to seeing what's happening inside. One of the main ones is a video fluoroscopic swallow study, or VFSS. It's basically a live-action X-ray movie of you swallowing. You'll eat or drink something mixed with barium, and it lets the whole team watch the entire process, from your mouth to your stomach, in real time. Another common one is a FEES, where they use a tiny camera on a flexible tube through your nose to get a direct look at your throat while you swallow. So, once there's a diagnosis, what's next? Well, management begins. And this isn't a one-size-fits-all solution. It often takes a whole team of specialists, doctors, dietitians, speech therapists, all working together. A huge cornerstone of dysphagia management is modifying what you eat and drink. And to make sure that everyone, everywhere, is on the same page, the IDDSI framework was created. It's this global standard that's absolutely critical for patient safety. It makes sure that a pureed meal in a hospital in one country has the exact same consistency as one in another, preventing any dangerous mix-ups. So let's look at a quick example. You've got minced and moist, which is made of tiny, soft, lumpy pieces that you barely have to chew. And then you have pureed, which is totally smooth, kind of like pudding, and needs zero chewing at all. These super precise definitions are vital for making sure a patient gets the exact texture they need to eat safely. And the exact same logic applies to drinks. A thin liquid, like water, can move really, really fast, sometimes too fast for someone with dysphagia to control. So by using a thickener, you can slow it down, giving those swallowing muscles more time to react and protect the airway. and you can thicken liquids to all different levels, from just slightly thick all the way to an extremely thick, spoonable consistency.
But here's the thing, it's not all about food consistency. Treatment also means things like therapy to strengthen swallowing muscles, learning special techniques like the chin tuck, managing other medical conditions, and sometimes even procedures to fix physical blockages. And these interventions are absolutely life-changing, especially when you think about just how many people this affects.
40%. Just let that number sink in for a second. So what is that number? That's the approximate number of adults over the age of 60 who experience dysphagia. This is not some rare, obscure condition. It is a widespread public health challenge. It's often tied to the natural aging process, because the muscles we use for swallowing, well, they can get weaker over time, just like any other muscle in our body. And the impact, wow, it goes so far beyond the physical. As this quote really highlights, the simple act of sharing a meal with people you love can turn into a source of fear and embarrassment. That can lead to social isolation and a major hit to someone's quality of life. You know, understanding the mechanics and the medicine behind dysphagia is the first step. But the bigger challenge here is a human one. And it leaves us with a really important question to think about. How can we, as a society, better support those for whom this simple, fundamental part of life has become a daily struggle?